Our economy is poised to come back and come alive. And I can see a return to normalcy in the next year. I also see incredible opportunities for our nation in the years ahead in job creation, clean energy, racial equality, and much more. But we need to be honest. The next few weeks and months are going to be very tough, a very tough period for our nation, maybe the toughest during this entire pandemic. I know it's hard to hear, but it's the truth. As Roosevelt said, I think the American people can take whatever we tell them if we tell them straight from the shoulder. We need to steel our spines for what's ahead. We need to follow even more closely the recommendations to slow the spread of the virus. And each of us needs to do what we can to protect ourselves, our families, and our fellow Americans. We're going to get through this. Brighter days are coming, but it's going to take all the grit and determination we have as Americans to get it done. So today, I want to be clear about 5 things every American should know about our efforts to contain COVID-19 and where the vaccine stands today. First, things are going to get worse before they get better. In September, we passed a grim milestone, 200,000 deaths. At that time, in this very room, many of you remember, I warned that we'd hit 400,000 deaths before the end of the Trump administration in January. Critics said I was being too alarmist and negative. But as I've said all along, I will tell you like it is when it comes to COVID. And the reality is, it looks like that we're going to hit that grim milestone. We've just crossed 330,000 deaths in America. We're averaging daily death rates of nearly 2,200 people, which means we'll lose tens of thousands of more lives in the months to come. So the Trump administration's plan to distribute vaccines is falling behind, far behind. We're grateful to the companies, the doctors, the scientists, the researchers, the clinical trial participants, and Operation Warp Speed for developing the vaccines quickly. But as I long feared and warned, the effort to distribute and administer the vaccine is not progressing as it should. A few weeks ago, the Trump administration suggested that 20 million Americans could be vaccinated by the end of December. With only a few days left in December, we've only vaccinated a few million so far. And the pace of the vaccination program is moving now, if it continues to move as it is now, it's going to take years, not months, to vaccinate the American people. The Biden-Harris administration will spare no effort to make sure people get vaccinated. I've laid out 3 challenges in our first 100 days. One of them is ensuring that 100 million shots have been administered by the end of the first 100 days. If Congress provides the funding, we'd be able to meet this incredible goal. It would take ramping up 5 to 6 times the current pace to 1 million shots a day. But even with that improvement, even if we boost the speed of vaccinations to 1 million shots a day, it will still take months to have the majority of the United States population vaccinated. This is going to be the greatest operational challenge we've ever faced as a nation. But we're going to get it done. But it's going to take a vast new effort that's not yet underway. And to get things, and that gets me to the 4th thing that we should know. I'm going to move heaven and earth to get us going in the right direction. I'm going to use my power under the Defense Production Act when I'm sworn in order private industry to accelerate the making of the materials needed for the vaccines, as well as protective gear. Vice President Harris and I have been speaking with county officials, mayors, governors of both parties to speed up the distribution of the vaccines across the nation. We're planning a whole-of-government effort, and we're going to work to set up vaccination sites and send mobile units to hard-to-reach communities. And we also know there's a vaccination hesitancy in many communities, especially Black, Latino, and Native American communities, who have not always been treated with the dignity and honesty they deserve by the federal government and the scientific community throughout our history. That's why we will launch a massive public education campaign to increase vaccine acceptance. We'll do everything we can to show the vaccines are safe and critically important for one's own health and that of their families and the communities. That means we're also going to make sure vaccines are distributed equitably, so every person who wants a vaccine can get it no matter the color of their skin or where they live. And we're going to ensure vaccinations are free of charge. Fifth, while the pandemic rages on, and as we increase the supply, distribution, and administration of the vaccine, we have to remain vigilant. As part of the 100-day challenge, I'm going to be asking the American people to wear a mask for the first 100 days of my administration. It's not a political statement. It's a patriotic duty. Another 100-day challenge is opening most of our K-8 schools by the end of the first 100 days in the spring. Look, we can only do that if Congress provides the necessary funding so we get schools, districts, communities, and states the resources they need for those so many things that aren't there already in a tight budget. They need funding for testing to help reopen schools, more funding for transportation so students can maintain social distances on buses. They need it for school buildings, for additional cleaning service, protective equipment, ventilation systems. This is going to require an additional tens of billions of dollars to get this done. All this, vaccinations, testing, protective gear, is going to require more funding from Congress, more than was just approved. That's why I'll propose a COVID action package early next year and challenge Congress to act on it quickly. Look, my ability to change the direction of this pandemic starts in 3 weeks. With thousands dying every day between now and then, let me conclude by discussing what needs to happen now. I congratulate the bipartisan majority on passing the President's and then the President on signing the COVID relief bill. It's still, it's a step, an important step, still moves in the right direction. And it will help people in need. And it'll pay for some, but not all of what we need to fix the COVID response. It's a down payment.